So we are going to look at ethical issues in nutrition practice. Basically, in nutrition, you are supposed to be promoting optimal health and well-being of individuals or groups of people. Okay, but in the process of you doing that, you realize that you will face ethical issues. Okay, you will face ethical issues that you will have to navigate. Of course, the ethical principles that we have been discussing related to doing good to the patient or to the client, that is beneficiency, not doing anything harmful to the patient, that is the principle of non-maleficiency, then the principle of confidentiality, not sharing information about the health of the patient with another person who is not authorized, and then issues of autonomy, that someone has the right to make decisions on their own. Okay, so those are the principles that govern nutrition practice. So in our discussions, we are going to look at the different scenarios and the ethical implications of these scenarios. So let's start. So the first issue that we are going to discuss is the issue related to access to adequate nutrition. We have different categories of people who actually experience difficulties or barriers accessing nutritious food. And consequently, they are faced with malnutrition. Often these people are people who are poor, they don't have enough money to buy food, and therefore we say that these people are food insecure. And then that means that it is most likely that these people will have increased number of malnutrition. What ethical implications are associated with this? One is that as health professionals, your interest is to identify populations or individuals who are at risk of malnutrition or who are food insecure, and then be able to do something that can make sure that their nutrition status or nutrition outcomes are actually improved. When you do that, you are following the principles of social justice and the equity. Social justice is a concept that understands, or that relates, it's a concept that relates to the fact that nutritional outcomes are usually influenced by social, economic, and political factors that may keep certain populations in situations of food insecurity. And if you address them, then you're going to improve the nutrition outcomes of the marginalized populations. So we move to the next point. You often go to the markets and you see that the foods are displayed in an attractive manner. Okay, the foods are well displayed, and especially in the supermarkets. And when you get these foods and try to read what the ingredients are and what they may portray to do, you realize that some of these foods are actually foods that are not healthy, but they are being advertised freely in the supermarkets and in different food markets. This is a challenge because advertising for things that actually cause poor health, that cause people to make poor dietary choices, that's not something that is actually good. It is not ethical. Okay? So sometimes they over-exaggerate the importance of certain foods. This is what we call manipulative marketing. It's not good because the children will see these attractive designs on given foods, sweets, for example, these processed juices. These actually persuade these children to go and buy these things, but these things actually have negative impact on health. Okay? So that is what we are saying, that this advertisement may actually result into negative health outcomes because of this persuasive marketing. This persuasive marketing is not ethical. Sometimes they over-exaggerate. So we move to the next one, which is related to what we call global food trade and agriculture. Okay? Now, this is where we get problems. You find out that countries that are producing enough agricultural produce may institute policies, trade policies that are unfair. Okay? This can be taken in a number of, this can be looked at in a number of angles. Those of you who are familiar with global news, you might have realized that the cost of wheat increased globally because Ukraine was at war. So, including other foods. That why is this increase? Why was there an increase? The increase could actually be associated with the trade policies that often make countries that are actually in need of wheat not getting them. Okay, so we have a lot of African countries that depend on foods from Europe, like the example I've given. But then when the governments of these producing countries impose policies that they don't want to export their produces for many reasons, then means those that are relying on these foods are actually not going to get the food. So you're basically denying people access to food. That is unfair trade policies. But we also have issues of exploitation. Okay, and this can be looked at in an angle of, if, for example, we have an economically powerful country, and there may be running shortage of, let us say, in South Sudan, we produce sorghum, although not at a large scale for export. But let us say a powerful country decides to say that they want sorghum from South Sudan, and each kilogram of sorghum is maybe $7. A lot of people will have to sell their sorghum. But when they sell this sorghum, they will be left in hunger because there will be no food back home here. Okay? That is a manipulative tactic. Okay? That is a manipulative tactic. And in the end, it could play in the favor of those who are buying, but in the long run, it may not be a strategic decision that could have been taken by the farmers to sell off their produce to the highest bidder. They can get the short-term income, but in the long run, they will be running around to look for what to eat. So there could be cases of exploitation. So we have what we call global trade actors. They can influence a lot of things. You can also have, let us say, a foreign country coming to South Sudan, and then they say, we want to grow rice. And then they grow this rice, but then in the process, they destroy the environment. For them, they get the rice, and then for you remain with your degraded environment. Okay? So these are basically the issues that need to be looked at. Then we come to the aspects of research. When you're conducting research among human populations, you must declare your conflict of interest. Who might influence, is there an organization who might influence the results of your findings? This could be because they're giving you some money for you to conduct a research. So you need to declare conflict of interest, because if you don't, your research is going to be deemed to be biased, and the conclusions or the recommendations may not actually be taken seriously. You need to be a person of integrity and also transparent in the conduct of any research that you can do in nutrition. But overall, the principles of ethical research, which include informed consent, confidentiality, privacy, doing no harm, this actually should be followed. Now let's come to issues to do with cultural considerations. Across the world, we don't have the same cultures. We have different cultures. You as a nutritional professional, you need to be culturally competent. We actually call that skill or that competence as cultural competence. Cultural competence is related to the fact that you should be respectful of people's cultures, regardless of whether they actually conflict with with the cultures that you have. So you should respect people's cultures. You should also be culturally sensitive. And cultures are related in the context of nutrition. We have foods that we don't eat here. But when you reach other countries, they are actually delicious foods. the snakes, the lizards, and others are delicious foods, but here we are not actually eating them. So when you find someone who is eating, let us say, grasshoppers, caterpillars, snakes, how are you going to behave? What is your body language going to be like? So this is about being culturally sensitive, being able to live with people of divergent cultures, okay? And don't impose your own cultures on other people. That could not be nice. So you cannot go to a particular community or population and then start to impose your own nutritional interventions that are contrary to the cultural beliefs of that locality. So you need to be able to understand the cultures of different communities. Informed consent, as one of the principles of ethics, is that you should provide people with the relevant information they need in order to make an informed choice. So it is basically related to autonomy, that people have the right to make their own choices. And it is very important that you actually respect them. But sometimes it is quite difficult to find a balance between respecting people's autonomy and actually promoting health outcomes. So for example, someone has the right to eat whatever food they want, but also you need to tell them that, you see, you want to eat whatever food that you want, but some of these foods are actually not healthy. So finding that balance to be able to tell someone to abandon certain habits may be a little bit difficult, but sometimes it has to be done. So we come to what we call conflicting nutritional approaches. This comes into play when you realize that actually nutritional practices, theories, models may actually be conflicting. Someone will tell you, and you must have noticed, someone will tell you that it's okay to take wine, and then someone else will say it is not okay to take wine. So who are you going to go with? Someone might have read in the textbook that taking 2 glasses of wine is okay. And then someone might have read it from somewhere else that taking wine, 2 glasses a day is too much. So who are you going to go with? Or a client is actually confronting you with such an issue. How are you going to guide them when you have contradictory information? Sometimes the research, information that comes from research is actually contradictory. They recommend this, and then they recommend something else tomorrow. So how do you navigate that? It's quite difficult. But the emphasis here is that you need to rely on the latest evidence and recommendations. So that means that you need to be a person who is actually knowledgeable. Then we have another concept. These days it is called body shaming. Body shaming. You are a nutritionist, but you are overweight or you are obese. But then you're telling me you're giving me nutritional advice to maintain my body weight, and yet for you have failed. But that is a barrier in this concept. So the concept here that we are talking about is, it is quite difficult. Okay, it is quite difficult to handle a case of clients who are having issues with their body image. This is actually one of the mental disorders. Some people are not satisfied with how their bodies are. Okay? So sometimes it is quite difficult balancing between health promotion with the risk of promoting unhealthy body image. Okay? You want to encourage healthy eating and physical activity, but in some way, the client is not actually satisfied with their body image. So how are you going to balance that? It could be quite difficult. For example, we have in South Sudan, we have a lot of models. If you want to be a model, there is a particular body size that, or body image that is expected of you. So if you meet a nutritionist, the nutritionist will tell you that you need to have more calories, yet for you think you're already fat. So that creates a kind of dilemma. Conflict of interest is something that we discussed earlier in research when we were looking about the ethical issues in nutrition research. What is conflict of interest? Conflict of interest is when you are being either intentionally or unintentionally, you are doing something that you have benefit, over. So let us say, for example, you are a nutritionist and you're working in your wellness clinic. And then you have this pharmaceutical company that has approached you that you sell one of their products. Okay. So when this company approaches you, they tell you that the more you sell, the more we give you bonuses. That means there are financial incentives. So most likely, because of this situation, every client who comes to your clinic, wellness clinic, you may be interested in actually giving them this product, even when they don't need. That's what we call conflict of interest. You're promoting this product because there is some bonus behind. Or maybe you are told to conduct research. This same company tells you to conduct research on the impact of this product. Okay? So for you, because you know that there is benefit from this company, there is a way you want the results to be like. It is conflict of interest. So you need to declare where you're getting money from in conducting that research. Otherwise, it is conflict of interest. And then this one is related to the fact that if you have limited resources, where are you going to put these resources? Okay, where are you going to put these resources? Is it on people who are actually well off or people who are worse off? Ideally, you want to put resources on the vulnerable population, such that there is equity, the concept that we talked about earlier on. Okay, so put resources to people who need those resources more. So the last slide is basically providing the key takeaways for this presentation. Is that in nutrition practice, you are encountering a lot of issues that require you to make decisions. And these issues usually raise ethical dilemmas, but it's very important for you to understand the whole issue and then do an evaluation of the whole issue and then reach a conclusion on the course of action. And then reflect and also evaluate the impact of the decision that you have made. That is how you manage ethical dilemmas in nutrition. So that marks the end of this presentation. I'm going to invite questions. Thank you.